All right, welcome back. This is Dr. Jin Sung, and today is Wednesday. I'm a day late because I was running late yesterday for a patient. So today I'm going to make a video regarding allergies and food sensitivities. Before I get started, as you know, I'm here located in Massachusetts. We're about 30 minutes north of Boston, right on the New Hampshire line. So we have quite a bit of patients coming from New Hampshire as well as Massachusetts, down in Boston, the Cape, out from Western Mass, and so forth. We are located pretty conveniently to the highway, so a lot of patients do not mind coming into the office, even though it's quite a distance away. So what I'd like to talk about to you today is about allergies and food sensitivities. So when we think about food sensitivities, most patients will think about just GI dysfunction. What kind of stomach problems do I have, right? When you eat a certain food, do I get bloated? Do I eat a certain food, I have loose stool or diarrhea? So the gas, the bloating, and the bowel movement changes is what we typically will think of when we think about food sensitivities. What if I told you that food sensitivities can create allergies such as skin conditions, eczema, brain fog, mood disturbances, depression, neuropathy, numbness and tingling in your hands and feet, right? So food sensitivities do not only manifest in the gut or the GI tract, it actually manifests elsewhere in the body because it's all intimately related. So if you eat a certain food that's not good for you, let's say gluten, okay, and you have a food sensitivity to gluten proteins, that might not manifest in the GI tract. Oftentimes, 2/3 of those patients will actually have other symptoms, more neurologically based, right? It could be fatigue, brain fog, gluten-induced neuropathy. There are some case studies that are showing that gluten-related proteins or gluten sensitivities can look and mimic Alzheimer's or Lou Gehrig's disease or lateral atrophic amyloidosclerosis. So it does not just manifest in the gut, it can actually manifest in other tissues such as nervous tissues. So food sensitivities and food allergies, which are two different things, but food sensitivities can create allergies outside of just the stomach. So the brain fog, the eczema, and skin issues especially, right? Or maybe even chronic ear infections for the child. They may actually have dairy sensitivity that creates issues in the internal ear and creates fluid buildup, right? So you see those children, they always get those antibiotics 2 or 3 times a year, and then eventually end up with ear tubes to drain the ears. That's really unnecessary. You just got to look at the different foods that the child is eating. What is the gut microbiome looking like for this child? And then improve that to improve ear infections. So there's correlations that people do not make related to food sensitivities. So gut health is important for immune health. So your gut has about 70 to 75% of immune cells there, right? So if you have poor gut function as a result of, let's say, food sensitivities, it's going to manifest in immune dysfunction. So your immune system will not function at its optimal. So it's very important to look at this in terms of allergies because it's overlooked. Oftentimes you're just given a Benadryl or some new antihistamine to take care of allergic reactions to skin. But in reality, it can be a food reaction. And if you eliminate the cause, not just treat the symptoms, you can do better, right? So I'm going to give you 6 steps that you can do to improve allergies, not just food sensitivities or GI problems, but improve allergies. So here in New England, most times people will get allergies around that springtime, and it gets pretty significant with the dust and pollen. Why do some people get allergies and why do some people do not? It's because of their immune system health, right? So in order to improve this, we have to improve gut physiology or GI physiology. So gut health equals immune health. So if you improve gut health, you will have less of a reaction to dust, pollen, foods, dander, etc. Right? So the 6 steps: eliminate food reactions. Eliminate foods that are commonly known to have allergic or not allergic, but sensitivities for a lot of patients, right? So when we look at the different types of foods, we're looking at gluten, right? Or even grains, certain grains that look like gluten proteins. So you want to eliminate gluten. We want to eliminate dairy. We want to eliminate soy or soy-based protein, lectins, nuts, seeds, and then nightshade-free. So sometimes tomatoes and peppers and eggplant and these types of things can create allergic reactions for certain patients. So it's important to understand that certain foods need to be eliminated so that your allergies, whether it be skin reactions or eczema or whatever it is, can be taken care of. So let me just describe this difference between, like, I have a peanut allergy, right? When you eat peanuts, you have, a significant reaction, and your throat may close down because of the inflammation and so forth. And that becomes a medical emergency. That's really an IgE response, meaning it's an immediate response. Within 30 minutes to an hour, you can have a full-blown effect. Those are the patients who need to take a shot of EpiPen, right? Or they need to be rushed to the hospital, or they need to take a lot of Benadryl to calm down the inflammation. So those are the food allergy categories, and that can become dangerous. What I'm talking about are those people who have sensitivities to foods. Those are the IgG category and IgA category. So when you look at IgG and IgA, that's a delayed response. So it's a slower response. It takes up to 3 to 5 days. So let's say I have gluten sensitivity and I eat gluten today, right? If I eat gluten today, 3 days from now or 5 days from now, I can experience a symptom. Symptom can be anything, right? It could be muscle pain. It can be joint discomfort. It can be brain fog or just more fatigued, right? So it's a delayed response. So that's what we're talking about in terms of food sensitivities, is this IgA and IgG immune response, not the acute response that needs urgent medical care. So the first thing to do is eliminate those foods. The second thing is you have to be able to provide digestive enzymes so your body can break down the proteins, the fats, and the carbohydrates that come into our system. You have to break it down to the points where these macronutrients become micronutrients, and the body can absorb it and utilize it in our systems. So what people don't realize is that a digestive enzyme is very, very important for overall function of the GI tract. It's also antimicrobial. So it breaks down those microbes that may be transported in the food, right? Raw foods and so forth. So if you have a healthy gut with proper digestive enzymes, then you can kill off the microbes before it hits the small intestine and large intestine and inoculates it and then lives in your body. So as we get older, around the 40 and 50 range, your enzyme production will be reduced by 1% every year, right? So given, let's say, a 40-year-old goes to 70-year-old, you're going to have a 30% reduction overall of enzyme production, right? And that's in a healthy, normal individual. What if that person has a thyroid problem? I have Hashimoto's thyroiditis. I have my gallbladder removed, right? I have chronic allergies. I'm on antacids all the time. Then your acid production is going to be much, much lower, right? So we're talking about 50%, 60% reduction in acid production and not being able to break down your proteins appropriately. So it's very important to have proper digestion. Digestive enzyme plus HCl or hydrochloric acid to break down the foods, right? Your macronutrients to your micronutrients. You have to be able to do that in order for the body to be nourished. Okay? Number 3, improve gut microbiome. What does that mean? It basically means improve the good bacteria in your gut. Oftentimes we neglect the healthy bacteria in our gut and we inoculate it with things like, antibiotics, herbicides, pesticides in the food, genetically modified foods, right? There are so many chemicals in our system that our gut microbiome takes a hit. So in order to correct that, you may need to take a probiotic or a prebiotic, things that help the healthy gut bacteria. If your healthy bacteria can flourish, it will suppress the bad bacteria, right? It'll keep it in check, right? The crime rate will go down. If you let the good bacteria diminish and you let the bad bacteria flourish, the crime rate will go up, right? So we want the lowest crime rate there is possible in our GI tract. We want to be able to have a healthy immune system, healthy absorption, right? So you got to eliminate those foods that create havoc in the gut microbiome, right? There's a new field emerging in gut health called the gut microbiome, right? The physiology, interaction of the millions of gut bacteria in our stomach or in the GI lining. It's a whole different area of study. But what I'm telling you is if you do some simple things like eliminate things that you have reactions to, support the digestive tract, right? So eliminate foods, digestive enzymes, and the third is a healthy gut microbiome. We need a healthy gut microbiome. The other thing is we need a good mucosal barrier. We need a good solid barrier within our GI tract. So when we look at this, we're talking about things like leaky gut. The new term would be intestinal permeability, right? It's when these bonds between your intestinal cells, they should be tight and only let micronutrients cross into the bloodstream. What happens is if you abuse your body with poor food, antibiotics, herbicides, pesticides, GMOs, you name it, it'll break the bond. And if that bond breaks, larger macronutrients or proteins will cross into the bloodstream, causing low-grade inflammation. That low-grade inflammation will manifest as brain fog, right? Depression, anxiety. It can manifest elsewhere, not just the stomach. That is the important takeaway here. It's not just the stomach when we have food sensitivity. It can be manifested in the brain, your skin, right? Your muscles, your joints. You have to be careful of your gut microbiome and your healthy mucosal lining, all right? Number 5 is your liver and gallbladder. So your liver needs to detox, and your gallbladder needs to dump bile, right? To help bind things and gets things out of in our stool. We need to be able to detox these chemicals and overload of toxins in our body. So there's something called a toxin overload summit going on, and they talk about all these different herbicides, pesticides, chemicals, mercury, arsenic, aluminum, all these things that affect our body, right? So you have to be able to detox some of this out. So the liver gallbladder function is essential for that. If your liver and gallbladder are not working and it's not functioning, it's going to start manifesting in your skin. You're going to start to get the eczemas, the skin irritations, right? Dry skin, unknown sores. It's going to start detoxing through the skin. So if you have a poor gallbladder and liver, and you start getting itchy skin, etc., it's an indication there that it's creating some problems for you. So that was number 5. And number 6 is your immune system. You have to be able to support the immune system, right? Healthy immune system, healthy gut, they play, it's basically a give and take. So the immune system needs to be healthy to support the gut needs to be healthy to support the immune system. And the immune system is very complex, right? There's a whole body of study called immunology. It's very, very complex. However, if you just think it and break it down in terms of what few things can we do to help improve function of the GI tract or the immune system, right? We look at something called Tregs or T regulatory cells. T regulatory cells are the guys who come in and kind of act like a referee between an overreaction of your Th1 and Th2 systems. So I'd like you to go back to some of my other videos and watch that, where I talk about immune imbalance and Th1 and Th2 stimulus and how it creates autoimmunity and immune dysfunction. So what we're trying to do is balance these two heavyweights right here with the referee. The referee is called T regulatory T cells, right, or Th3. That is modulated by vitamin A, vitamin D, right, glutathione, essential fatty acids. You need to have a strong referee to keep things in check. If you don't, then your immune system goes awry. If your immune system goes awry, then things can happen, like autoimmune disease, Hashimoto's thyroiditis, rheumatoid arthritis, right? So let's go back and recap this real quick here. Elimination of food, digestive enzymes, healthy gut microbiome, mucosal support, liver gallbladder dysfunction you need to correct, and then immune support. If you can do those 6 things, you can help improve your food sensitivities, you can improve allergies, right? And these weird symptoms that might just be popping up on you that you have no idea why, right? You know it. You have a symptom, you go to your doctor and you go, "Doc, I'm having this exorbitant amount of fatigue." They run some blood tests and they come back and they go, "Hey, everything came back normal. No, maybe you should just go exercise a bit. You need more exercise. You need more sleep." Right? Without any instructions on how to do the proper exercise or how to do a proper sleep protocol, right? Or just say, you need to eat healthier. Have more wheat, right? Whole grains. And what I'm telling you is whole grains can create problems. So it's a big problem in terms of how patients are addressed in the early stages of food sensitivities or food allergies, because oftentimes it's ignored because the blood test is normal, right? So let's go through the 6 steps real quick and then give you some suggestions, right? Food elimination, right? Gluten-free, dairy-free, soy-free, lectin-free, nightshade-free. Basically, it's called an autoimmune protocol or autoimmune paleo diet, right? Or a paleo diet. That's a good starting point to see how you do and see if that helps. You need digestive enzyme support with something called HCl, and then digestive enzymes that support the breakdown of your foods. Healthy gut mucosa, right? Or healthy gut biome, let's say first, is looking at probiotics and prebiotics. And there's some good companies out there, so don't just buy those cheap things that you can buy a tub of something for, I don't know, a tub of probiotics that sits on a shelf, not even refrigerated, for $5, right? Good probiotics cost money, and it has to be processed properly. And most of the good probiotics tend to be refrigerated, although there are some that are what we call heat stable, so it's okay in room temperature, like Saccharomyces boulardii. Some of the companies can make it room temperature stable. Gut mucosa support is things like glutamine, aloe vera, diglyceride licorice, and so forth. There's a package of supplements that can be utilized to help support the gut mucosa. And then the liver and gallbladder support. So the liver needs to go through 3 phases of detox, which include the gallbladder. So there's things like methylation, sulfation, glucuronidation. There's a lot of these processes that need to go on in the liver, and it needs a lot of nutrients. I use a product called Clearvite, which is a liver detox protocol. It's a powder with some protein in it, and it's got all the nutrients that allow you to detox. And then I also use a gallbladder support called Bilemin out of Apex Energetics. So you need to be able to detox that liver and gallbladder out. And then the immune support. So you need some vitamin A, vitamin D, glutathione, essential fatty acids. You got to check your level for vitamin D. I mean, the fat-soluble vitamins, you got to be cautious not to take too much. So it's important to check your levels for vitamin D before you take high doses of it. But it's an important nutrient or vitamin for immune regulation. Okay, so that was a lot of information there. If you're interested in doing something and you want to call our office is 978-688-6999, and my website is www.drjinsung.com, and you can go ahead and request an office visit. What I'm telling you today is the basics. It's the foundational stuff that you need to do in order to improve your health, right? Things can be more complicated because if you're looking at gut, you have to look at maybe a stool test to look at the gut microbiome, along with, do we have a parasite, right? We have, things like pinworms, roundworms, H. pylori, protozoan infections, and so forth. So it's important to get rid of those types of infections also. But what I'm telling you is very foundational. Everyone should do it. And some patients ask me, oh, how long should I do this? Well, how long have you been sick? And how long are you going to be exposed to all these things that make our gut microbiome poor? So the simple answer is, you're going to do a protocol or do something for your gut at least twice a year, right? Because you want to be able to maintain things once it's healed. And you have to do something continuously, right? You can't exercise one time or just for 1 year. Let's say you exercise for 1 year and have that benefit for the rest of your life. You have to exercise on a regular basis. You have to take care of yourself on a regular basis. You have to eat the right foods on a regular basis. You have to do all the necessary things to get better. It's that simple. Okay? I'd like you guys to share and like the page. Our channel is growing slowly, and I like to spread the word. Please get the word out there for me. Next Tuesday is our next regularly scheduled live video. So please tune in at 12:30. We'll hope to deliver a great lecture for you next week also. All right, have a great day. We'll see you on the healthy side.